Saskatchewan Premier Scott Moe was among the provincial and territorial leaders on a call last night with the Prime Minister. And the Premier joins me now from his home in Shelbrook. Good morning. How are you feeling? We know you're in isolation. What's the latest on your health that you can share with us?
Well, health seems good, Marcia. We were apparently in contact or in a business where someone tested positive, and so my wife and I have been self-isolating and will continue until Sunday. But we feel good, and just thankful for the public health advice that is out there, how effective it is, and the fact that it's being provided in a fairly timely manner.
Well, we're glad to hear that. Let's turn to that call last night that the premiers had with the Prime Minister. What was discussed on the vaccine front? Did you get the answers that you were looking for?
Well, I think we got to start to some of the answers that we're looking for. The real questions are, how many vaccines are we going to get and when are we going to get those? And the reason provincial premiers need to know that is we need to engage our health departments to roll out the actual physical distribution of these vaccines through our provincially led healthcare systems. So we need to know when we can ramp up those vaccination programs and how we're going to actually deliver that vaccine. So we did hear last night that there will be 6 million doses, which will treat 3 million Canadians through the first quarter. So January, February, March, it looks like we'll have about 3 million Canadians that we'll be able to treat across the nation. That's less than 10% of Canadians, and we're hoping for more. And we're going to continue to press the Prime Minister and the federal government to procure more of these vaccines in a sooner, quicker manner, so that we can get them out to all Canadians.
So to be clear, the Prime Minister said that the first doses of the vaccine would be distributed in January.
January, February, March, we will have enough vaccines up until that first quarter, those 3 months. Enough vaccine to treat 3 million Canadians, less than 10% of Canadians. Why this is troubling and will be troubling for Canadians and is troubling for me is we are seeing, the United States, the UK starting to roll out their vaccination programs here, likely mid to late December, and with many more doses than we obviously are having in Canada. In fact, there's a number of countries around the world that looks like they're going to have access to many more doses than we are in a more timely fashion than we are here in Canada. And so we need to know when those doses are coming so that we can have our health and healthcare systems and vaccination systems in place. And so I guess that's what we'll plan for, unfortunately, is to vaccinate less than 10% of our population in the first quarter of the year.
Yeah, we know it's going to be a Herculean effort. And I think your feeling about it being troubling is the same feeling that a lot of Canadians have. It's troubling and it's frustrating to not know when it's coming. Was that brought up with the premiers? How would you describe the tone? Did you get the sense that other premiers were feeling frustrated as well with the lack of details?
Yeah, for sure. I think there is a general frustration, as it is the provinces that are going to actually on the ground deliver these vaccination programs. So we need to plan, and we need to plan accordingly. And we're, attempting to do so. And we obviously want access to as much vaccine as possible, as soon as possible. And it doesn't look like we're going to have the access that maybe we were led to believe we might have on September the 25th, when the Prime Minister made some announcements around some of the agreements, I believe 7 agreements that he has made. So that's a little bit unfortunate, but we will ensure provincially that we will deliver every vaccination that we have as efficiently as we have and as quickly as we can at the provincial level.
Were the premiers informed last night that Major General Danny Fortin would lead the vaccine distribution efforts, and how do you feel about that?
There was very little discussion about that, although it was mentioned that there would be some lead on the vaccination efforts. Listen, at the end of the day, there is some logistical challenges with a few of these vaccines, the Pfizer vaccine most notably, with the temperatures it needs to be stored at. So it's appreciated when you have someone leading that effort, but ultimately the effort On the ground, the vaccination programs themselves will be led by the provinces. Once this vaccine is dispersed on what I assume will be a per capita basis, and all indications are likely will be a per capita basis. But the provinces deliver flu vaccines, they deliver the H1N1 vaccines. That is ultimately who is going to deliver this vaccine through our health departments, our public health employees that we have in each province.
And do you feel confident that you'll be ready on day one?
We'll be ready here in Saskatchewan, and I'm confident that our healthcare systems across the province will be ready. Provinces are already preparing for this. I think what we would like, and I think what all Canadians would like, is some clarity on exactly when these vaccines are coming from the provincial level. We would like a week by week type of clarity so that we can ramp up, ramp down our vaccination efforts. And I think the second question is we would like more, like many other countries, not just those producing countries, but like many other countries seem to be having access to additional vaccines in addition to what we're getting access to. So I think that's something that the federal government can continue to work on. They've really had three things to work on in addition to some support measures for Canadians, and that has been to ensure that international travel is done so safely. And we've seen the isolation requests or laws come in there. They have been supporting provinces to some degree with testing, not to the degree that we were hoping, but to some degree with testing. And then ultimately to procure a vaccine for all Canadians. And that is this is what the federal government needs to continue to keep busy with, is to providing that access as soon as possible so that the provinces can deliver these vaccines to all Canadians from coast to coast to coast.
Yeah, and did you get off that call feeling like the lines of communication were more open? Did the Prime Minister commit to having that weekly update on the vaccines?
We've had weekly or bi-weekly updates here now for months with the Prime Minister. We've had our Council of Federation calls also weekly that have been very productive over the course of this pandemic and even a little bit previous to that. And so the lines of communication are there. It's just not always the answers are there. Sometimes, in fairness, maybe the answers aren't available. But when they are, in particular in these times, and I think all provincial leaders have certainly learned this, it's in the best interest of all of us to be as transparent as we possibly can with the people that we represent. That's what premiers are asking for here is, let's have a look at these contracts. Let's see where and when the vaccines are coming, and let's work together to try to procure additional vaccines in a more timely fashion. We are going to need more vaccines than 6 million doses to treat less than 10% of our population in the first quarter. Ideally, we'd like to, maybe double or triple or even get at it up to 4 times that amount and get some of our most vulnerable and our essential workers across this country vaccinated so that we can start to carry on business. This is the goal that we've all been heading for, the finish line, if you will. And all of that we've been doing over the course of the last 8 or 9 months now have been in focus of accessing this vaccine.
Yeah, for sure. The light at the end of the tunnel, as the cliche goes. One last question before you go. Let's turn to what's happening in Saskatchewan. We know that there are new measures in effect today to stop the spread of the virus. What's been the reaction?
We're at the point in this response to COVID-19 where there are reactions on both sides. But at the end of the day, we need to work together as communities, as individuals, to ensure that we are doing the very best to keep our family members safe. Listen, there's some that aren't particularly fond of the fact that we have put a pause on our youth athletics, as well as really reduced a lot of things that we are doing in our community, such as visiting restaurants, and our worship services also have been reduced in their numbers. But we also have our intensive care and our hospital capacity is being utilized now by people that have COVID rather than people that need to access those beds for other types of surgeries that people expect to be able to access in this province as well. We have, an economy that we're doing everything we can to ensure that we can continue to keep it open and keep it as strong and vibrant and ready for a full recovery post-COVID. And we have still the majority of our children are in class here, trying to keep some degree of normalcy in their day-to-day life. So we're trying to keep that healthcare, that education sector, and our economy rolling along. And by putting in some degree of restrictions here now to keep this virus at bay, until such time that we can procure this vaccine, which brings us back to how important it is for us to procure as many doses of this vaccine as soon as possible.
Premier Scott Moe, thank you so much. Continued good health to you and to your family. And again, appreciate your time with us this morning.
And the same to you, Marcia. Thank you.